Today on Cityline, community support for people experiencing homelessness. The group's providing shelter, stability, and opportunities to succeed. Thank you so much for joining us. I'm Jessica Brown. You know, winter weather is dangerous for everyone, but especially our area's homeless population. During Boston's 2025 homeless census, about 5,500 people were unsheltered on the street, staying in emergency shelters or using similar housing programs. That number is down from the previous year when 5,700 people were counted. One of the largest homeless services providers in Boston is Pine Street Inn. The organization offers housing with support, emergency shelter, street outreach, and workforce development. Pine Street Inn has so many success stories. Our Erica Tarantel recently checked in with a man who we first met when he was unhoused.
This was the summer of 2024. Philip Hall, a guest at Pine Street Inn, shared with us skills he'd learned in their I Cater program.
Today, we're going to do a stir-fry dish.
The culinary job training program was just one support he took advantage of at Pine Street, with the goal of lifting himself out of a desperate time.
And I thought I wasn't going to make it. And if I wasn't here, I don't know where I would be right now.
Our job is to sort of help them, whatever level they're at, move on to something bigger and better for themselves.
Ty Irwin worked with Phil, optimistic from the start.
Well, Philip made it easy because, first of all, he's got a winning personality. He was a bit on the shy side. He came out of that shyness in the classrooms. He asked questions. He was genuinely curious about things so that you knew he was not only interested but motivated.
Phil was determined to find a job and housing. Deb Green helped him navigate that piece.
He made it clear that this is not going to be his home.
But with wait lists of months, even years for apartments, it took patience and dedication.
He thought he wasn't at first because we was here for a while, but he pushed through,
Phil started 2026 in his first ever apartment. It took more than a year after securing work.
Phil, congratulations.
Thank you.
This is so exciting.
Shortly after we first met Phil, he was hired as a nutritional assistant at Brigham and Women's Faulkner Hospital. A job both stable and rewarding.
I wanted to find something that was meaningful, helping people.
He helps patients follow dietary guidelines.
And that's a vegetable lasagna I made. Has roasted tomato, onions, peppers.
Healthful food is something he is passionate about.
You've been enjoying the new kitchen.
Oh my gosh, been taking such advantage of it. Yeah, I'm so happy.
This is a tough city to live in. It's too expensive and housing is crazy. But there's ways to succeed in it. And Pine Street is the one that I found is the best bet for that success.
Phil says his is a story that he hopes will inspire others not to give up.
Hold on, keep your faith, and just, persevere. Being in here, having my own place, I can dream big. And that's a stake I did, even though I don't eat bread.
Such a great story. Joining us now is Lyndia Downey, President and Executive Director of Pine Street Inn. Thank you so much for being with us.
Happy to be here.
I mean, when you see stories like Phil's, you see stories like this quite often at Pine Street Inn, but what do you feel, or what do you think when you take that in and you get to hear those stories?
Phil's an amazing, lovely man who worked so hard through a mental health crisis to rebuild his life. Came to shelter really thinking this was it for him. Came into our training program and I Cater, worked with Deb, one of our case managers and housing placement specialists. And I give the credit to the staff and to Phil. They just stay with it, and they encourage people to keep at it, even though there's all kinds of obstacles in the way of getting out of homelessness.
Absolutely. I'm curious to ask you, what are some of the tools you have to help people like Phil rebuild their lives?
So for someone like Phil, who early on raised his hands and said, okay, I'm here, now what? We have a job training program in culinary arts. It's called I Cater. It's a catering company. We provide food to other nonprofits, and that helps fund the training program to help people get a job so they can get out of homelessness. Housing search, which is really a big piece of what we do. And then Pine Street, we build, and we are a partner with a lot of other groups on building additional housing with support for people who need not just an affordable place to live, but some support to hold on to that housing.
Yeah, I know in recent weeks you guys have been well over capacity, right? I know the weather has been a factor in this. What else is causing that demand, and how are you handling it?
Well, I think the weather, we always see an increased demand for shelter during the winter, and past 2 years our numbers are up about 24%. Now the numbers in the city aren't up that much. We've just been lucky enough to have some state funding from the administration to add some additional bed capacity. We've opened our lobby as a warming center for people who want to just come in for a little while. So we always see increased demand. Having said that, there's two things that make me worried. One is we're starting to see older people who are homeless for the first time. Maybe they were living with a relative who passed away. Maybe they were a caretaker for someone. Maybe they lost a spouse. In some cases, these people were not on the lease. The primary tenant leaves or gets sick or passes away, and they can't stay. Finding housing by yourself, if you're on a fixed income, really difficult. The second thing I would say, and I think Phil's a good example of this, is people who they just need a bridge to get out of homelessness, but it's really housing costs that are driving them into our place. And that's been hard to control. Despite everything and lots of efforts, I think we're still not seeing rents even stabilize.
Right. Well, how do you address this overcapacity, though? I mean, you have so many people that need the help, and you may not have enough of the space. How do you deal with that?
Well, space right now is at a premium, believe me, and it's not pretty. I'll be very frank. We're doing the best we can to get through this pretty cold and snowy winter. We've added bunk beds, for example, upstairs. Not everybody loves the top bunk, so you got to persuade mostly the younger folks to get up on the top bunk. We've added cots and mats in our lobby when the beds are full, and then we've opened, as I said, our dining room. Just if some people can't come in and take a bed and they can't stay the whole night, it's too much for them, just enough to get people in out of the cold. And then for people we see through our outreach vans on the street, sometimes we just say to them, if you don't want to come in, just get in the van for a few hours. It's hot, we've got soup and sandwiches, we've got blankets and clothing. Come and let us help you get through the night, and we'll keep working with you, but at least try and get in out of the cold for a little while.
Yes, absolutely. I know in January, hundreds of volunteers, they did the census, the Boston's annual homeless census for 2026. We know people from Pine Street Inn were part of that group. Why is this done each year, and how do you take that information and apply that for what you all do to service the community?
So any community that gets HUD funding is required to do a census in the winter months. Usually it's January, and you are required to track certain numbers. How many people in shelter, how many people in the street, and then Boston tracks a couple of other transitional programs. That data then gets fed into HUD in Washington, and they basically compile it all, and they look at very specific numbers, shelter numbers, street numbers. They look at veterans numbers. They look at, for example, younger unhoused youth. And that gets published in a large report called the Annual Homeless Report to HUD, where you can look and see, how is your city doing compared to other cities? Have you made progress? Where are you losing ground? And where have you been successful?
Well, let's talk about some of the problems, though. Can you talk about some of the progress that's been made in recent years when it comes to addressing homelessness in Boston?
I would say there's really three places where Boston shines, despite sometimes what I think people hear. One is the number of vets since we started counting vets, I think in 2011, Boston's had about a 57% decrease in the number of veterans that are homeless. So we had 3 unhoused vets in 2025. 3 too many, but the focus on housing first and housing targeted right to vets has made a huge difference. Our street count remains extraordinarily low compared to other cities. So about 2 to 3% of the whole homeless population in Boston sleeps out, right? Even though there's a lot of focus on that group, it's only about 2 or 3% of the total number. San Francisco is 55%. Portland, Oregon, it's 45%. So we've done really well there. The other place Boston's done well, and we don't talk about it enough, the folks that are long-term homeless in Boston, which is the group that ends up on the street often for years, in shelter for years, that we work on supportive housing for. The national average is about 20% of a homeless population in a city is chronically homeless. In Boston, it's 9%. So we're 50% below the national average.
Which is great to see. Let's talk about this. Boston officials, we know, released a framework to address public health safety concerns around Mass and Cass. Okay, so their recommendations include this: expanding specialized public safety units, establishing a specialty court so people can choose a recovery path over criminal charges, and dedicated case management teams. So how would the implementation of these recommendations build on what you all are doing, the work you're doing?
So I think there were some great recommendations in that report around coordination and around using the judicial system in a way to support people. So some really good stuff in there. I don't think it's been fully vetted yet, frankly. I think this is, the very first time a lot of people are seeing it. There's never any one size fits all in this, and I think everybody wants one thing. So I think there are, as I said, some very good recommendations. I think for some people this will absolutely work. For other people where there's relationship building already happening and where they might be close to housing or treatment, you want to keep that going and not, frankly, scare them off too much by too much of a heavy hand. And I think it's getting a balance. Probably the best recommendation from the report is really coordinating the treatment process for people, all the way from the day you walk into treatment to whatever beyond detox to transitional, and then to housing, because when people finish treatment, if you can't get them housed and they've got to go back to the streets, it's going to be really hard for people to stay clean.
Really quickly, I want to really talk to you about funding, especially at the federal level. We've been seeing cuts across the board here. How has that impacted you, if at all?
So about 6 months ago, the current Trump administration announced a shift in how places like Boston and other cities get HUD money. We use most of that money in Boston. 90% of it goes to housing. In what HUD has said is we only want 30% of it to go to housing. That was the initial where we started. And of course, panic and fear, because these are people that are already housed. Money we're spending today to keep people housed and off the streets. And through a lot of legislative work, and very grateful to our congressional and Senate delegation, we did get some language where 60% of it we think is going to be able to stay in housing. It's still a cut from 90%, better than where we started. We're still going to have a gap, and it's going to be, we're not, I don't think, going to know until the summer when we see the HUD regulations get published what it's exactly going to look like. But we're all doing contingency planning, not just in Boston, but across the whole state.
Yeah, absolutely. Linda Downey, we really appreciate you being here and the work that you do in the community. So thank you so much.
Well, thank you.
Coming up, decades of doctors making a difference. The program bringing high quality health care to Boston's homeless population.